If you are in pain and you are not sleeping well, those two things are not a coincidence. Here's something that took me a long time to fully appreciate in clinic. People come in with a tendon problem or a knee or a hip. We work through the loading, the rehab, the movement patterns, and then at some point I ask, how's your sleep? And almost every time people whose pain isn't responding the way it should, they are sleeping badly. And for a long time, the assumption was, well, they're in pain, so of course they are not sleeping well. Pain causes poor sleep. That's just obvious. But here's what the science has been quietly establishing for the past decade. The relationship runs the other way too. Poor sleep causes pain. One night of disrupted sleep is enough to lower your pain threshold. Multiple nights in a row and you are looking at widespread hypersensitivity. Your nervous system interprets signals as more painful than they should be. And for people who are already injured, already managing something chronic, bad sleep is one of the most significant things working against their recovery. I want to walk you through exactly how this works, the biology of what happens inside your nervous system when you don't sleep, why it amplifies pain, and what you can actually do about it practically tonight, not just in theory. By the end of this video, you'll understand something that most people, including a lot of clinicians, have underestimated for years. Let's get started. So let's start with the biology. Because to understand why poor sleep increases pain, you first need to understand what sleep is actually doing for your nervous system while it's running. Most people think of sleep as passive. Your body shuts down, you rest, you wake up. That's not what's happening. Sleep, particularly deep sleep, your brain is clearing waste products, the immune system is regulating itself, hormones are being secreted in patterns that don't when you're awake. Here's what I mean by that. Your nervous system is not a passive receiver of signals. It doesn't just detect damage and report it neutrally. It modulates, it amplifies or damps down the incoming signals depending on your internal state. There are systems in the brain and spinal cord that actively inhibit pain, what we call descending pain inhibition. Think of them like a volume knob that turns down the signal it fully registers as pain. And during sleep, specifically deep uninterrupted sleep, those systems restore and reset. When sleep is cut short or fragmented or chronically insufficient, the resetting doesn't happen. The inhibitory systems become less effective and the pain volume knob gets stuck turned up. And importantly, here's where it gets particularly relevant for anyone dealing with a running injury or chronic musculoskeletal pain. Because sleep doesn't just affect how your nervous system processes pain, it directly affects the biological environment your tissues are sitting in. When you sleep poorly, inflammatory markers go up. Specifically, 3 you need to know. Interleukin-6, what we call IL-6, CRP, which is the C-reactive protein, and tumor necrosis factor alpha, TNF-alpha. These are inflammatory cytokines. These are the chemical messengers that tell your immune system something is wrong. In the short term, they are helpful, they are part of how your body heals, but chronically elevated, they do 2 things that matter enormously for pain. First, they sensitize peripheral nociceptors. Nociceptors are nerve ending in the tissues, in your tendons, your muscles, your joints that detect potentially damaging stimuli. When they are bathed in elevated inflammatory markers, their threshold goes down. Things that wouldn't normally trigger them do. Movement that shouldn't feel fine hurt. Second, chronic low-grade inflammation maintains and amplifies central sensitization. Central sensitization is what we call the state where your central nervous system, your brain and spinal cord, has become hypersensitive. The alarm system has been wound up. It's an elevated inflammatory markers are one of the inputs that keep the system in a sensitized state. Now tie this back to sleep. Every night of poor sleep adds fuel to that inflammatory environment. Not a massive spike, but a consistent low-level elevations over weeks and months, which is how most people are sleeping if they have chronic pain. The cumulative effect is significant. Their pain isn't just coming from the tissue, is coming from the biological environment those tissues are sitting in. And that environment is being maintained in part by poor sleep. This is that part I want you to really sit with, because this is where a lot of people are trapped and they don't realize it. Pain disrupts sleep. We all know that. It's obvious. If your Achilles is throbbing at night, you are not sleeping well. If your hip is aching every time you roll over, you are waking up. But what we have just established is that sleep disruption also amplifies pain, which means the pain wakes you up, you sleep badly, your pain threshold drops, which means everything hurts a bit more the next day, which means it's harder to sleep, and so on. This is what researchers call the pain-sleep cycle, and once you are in it, it can be generally difficult to break it. This is why people come in with a pain problem that should be responding well to treatments, but still experience pain after weeks or months. The tissue work is good, the loading program is appropriate, but they are not recovering between sessions. And when you dig into it, they are waking up 3 to 4 times a night. They're taking an hour to fall asleep. They're getting 5 broken hours to calling it a night. The rehab can't outrun the biology. Now I want to be honest here, because I know the obvious question is, if pain is what's causing the poor sleep, how do I fix the sleep without fixing the pain first? And this is generally one of the more complex problems in chronic pain management. But here's what evidence tells us. Even partial improvement in sleep quality can meaningfully shift the pain experience. You don't have to resolve the pain completely to start sleeping better. You don't have to sleep perfectly to start reducing pain sensitivity. Small wins in sleep can create a positive cycle, just as the negative cycle works in the other directions, which means sleep is a genuine treatment target, not an afterthought. So let's get practical. Because I'm a physio, not a sleep therapist, but after years of treating people in chronic pain and watching sleep be the unaddressed factors that explain why some people recover and others don't, I've learned what actually helps. Let me give you the framework I use. The first thing is protect your sleep window. Most people shortchange sleep by cutting the end of it short, late screens, social media, 1 more episodes, and suddenly it's midnight and you need to be up at 6 o'clock. That final hour or 2 of sleep is disproportionately important for pain modulation. Here's why. Deep sleep, the stage most critical for tissue repair and growth hormone secretion, happens more in the first half of the night. But REM sleep, which is associated with emotional and pain memory processing, concentrates in the second half. If you're sleeping 6 hours instead of 8, you're not just losing 2 hours proportionally. You're cutting off the majority of your REM sleep. The practical target for people managing chronic pain is 7 to 9 hours in bed consistently. Your nervous system adapts to a sleep-wake pattern over time. Irregular schedules, sleeping late on weekends, short nights during the week, fragment that pattern and reduce sleep quality even when total hours looks acceptable. Thus, consistency matters as much as duration. The second thing, manage pain before bed, not through the night. This sounds simple, but most people don't do it strategically. If you're in pain and you're waiting for it to wake you up, you're already behind. If you have an injury that consistently disrupts your sleep, position management matters. For low limb injuries, elevation and rest can reduce overnight aching. For load-sensitive tendons, Achilles, patella, avoiding loading position for several hours before sleep reduces overnight irritability. For some people, a short, gentle movement routine before bed actually settles the nervous system more than stillness does. Light, non-provocative movement, not stretching a painful tendon to end range, but gentle low load movement can reduce the baseline arousal that makes it hard to fall asleep in pain. If you're using analgesics, paracetamol, NSAIDs, if sleep is generally behind, timing them to cover the sleep window is something worth discussing with your GP if sleep is generally being disrupted. The third thing is address the arousal problem, not just the sleep symptoms. This is part most people skip. Poor sleep isn't just about the number of hours, it's about what your nervous system is doing when you're trying to sleep. People in chronic pain frequently have elevated physiological arousal higher baseline heart rate variability, heightened Saturn responses, difficulty downregulating. This is nervous system in a threat state, and the nervous system in a threat state doesn't sleep deeply. The evidence for cognitive behavioral therapy for insomnia is actually stronger than the evidence for most sleep medications. It works by directly addressing the thought patterns and behaviors that maintain hyperarousal. You don't need to do a full CBTI program, though if sleep is severely disrupted, that's generally worth pursuing via your GP. But even the core principle helps. Get up if you can't sleep rather than lying there. Keep the bed for sleep only, not for scrolling, not for watching, not for lying awake worrying. And this is a counterintuitive one. Don't try harder to sleep. The effort of trying to sleep creates arousal. The goal is to reduce arousal, not to force sleep. The fourth thing, understand that this is part of your recovery, not separate from it. This is the mindset shift I want to share with you. Sleep is not a lifestyle recommendation. I'm throwing it at the end of the video. It is a direct biological input into your pain system. Poor sleep elevates inflammatory markers. Poor sleep reduces descending pain inhibition. Poor sleep sensitizes your nervous system. All three of those mechanisms are working against recovery every single night. If you're doing your whole rehab, managing your load, taking care of your nutrition, and not prioritizing sleep, you are leaving one of the most powerful recovery levers unpulled. Let me bring this together. Poor sleep sensitizes you to pain. The cycle is real, it's measurable, and it can run for months or years without anyone naming it as part of the clinical picture. The biology is clear. Sleep deprivation elevates IL-6, CRP, and TNF-alpha. It reduces descending pain inhibitions. It makes your nociceptors more reactive. It maintains central sensitizations. One night is enough to see measurable changes in pain threshold. Now, if you multiply that by weeks of broken sleep while you are managing an injury, the tissue might be ready, the nervous system might not be. And that is not a personal failing, that is biology. The good news is that this cycle can be interrupted, but gradually with small interventions that compound. Protect your sleep window, manage pain before bed, not through the night, address arousals, and understand that sleep is a treatment, not a bonus. If you've been injured for longer than you expected, and you're also not sleeping well, I would encourage you to take this seriously. Not as extra advice on top of everything else you're doing, as the part that might actually be the missing piece. If this video helped you think about your recovery differently, the next one on how chronic pain actually changes your brain is something I would recommend watching next. Because the story doesn't stop at the tissue. It never does.